to healthcare and medicine. A lot of questions, maybe concerns, apprehensions. So I thought I'll spend a few minutes talking about my experiences on return to India and especially on the healthcare topic and how I navigated the system and maybe give some ideas and narratives. So when it comes to healthcare in India, there's a whole range of healthcare services, providers, and facilities across the country that you can benefit from, right? Starting from local clinics, local doctor shops, doctors' offices, which are dotting all over the country. Literally, every street corner, every major city, every doctor's clinics, doctors are practicing there, and you need to check the hours, and those are pretty inexpensive. A simple doctor's visit may run you anywhere from 200 to 300 to 400 rupees based on the locality, based on the doctor's practice. And for basic services, it is pretty convenient. Like, for example, earlier this year, I was climbing a stool and bruised my leg. So I had to rush to the doctor immediately to get it checked. The process was pretty simple. The local doctor cleaned the wound, put a bandage, and sent me back home with a tetanus injection. Pretty straightforward, pretty convenient, and very accessible. So that is the first level. Likewise, you might have smaller clinics, smaller medical centers in major subdivisions, major localities all over the country. Some of them are part of the bigger chains, or some of them operating independently. Your insurance, if you have a corporate insurance, central government insurance scheme, or you just pay, and it's pretty affordable. The next level comes the Apollos, the Aster, the Baptist Health. Those chains have standardized healthcare across the country. So they have taken over large facilities, large hospitals, and set up maybe 100 bed, 200 bed facilities in various corners of the country. Like, for example, Apollo Clinic, Apollo's healthcare system spans maybe 400-500 hospitals across the country. So that's the next level. And then comes the more specialized hospitals. Now, the more specialized, say if you need oncology, if you need to see a specialist in physiotherapy. So there are clinics, there are hospitals specialized in those cares, right? For example, when my father was undergoing hospital treatment for cancer, I took him to the command hospital. Now the facility was pretty updated. The doctors were very knowledgeable. You had oncologists, you had neurologists, you had specialists available. The only catch is the wait time. It takes a few hours because the sheer amount of crowd to meet the specialist. Even with an appointment, it may take a few hours waiting to meet the specialist. And likewise, the commute, because to meet these specialists. So for example, my dad's cancer treatment. So every few months I would take him for his injections, for his immunotherapy injections. Now, it is accessible, available. The only catch is you need to budget about half a day or a day to commute or go there, wait for the specialist, finish that course of treatment, and then come back home and recuperate. So you need a caregiver, you need someone to help you navigate that. This is for more specialized health needs. Now, my dad was fortunate because I had moved back to India to be around for him, to help him in that process, that journey. Now, my mother alone wouldn't have been able to do it. So that brings us to another topic about caregivers. Caregivers are available in India. They are affordable, but you need to be around to manage and supervise them. So it's not a self-managed system because you can't totally outsource that. You need someone trusted who can manage these caregivers, keep an eye on them. And of course, if you have a long-term caregiver for someone going through treatment, you need to continually monitor them. And these caregivers also burn out. So when a caregiver leaves, you need to hire, or the agency may replace it with another caregiver. So that's another thing you need to factor in and work through. Another topic worth mentioning is, say, online medicine, telemedicine. Telemedicine is really taken off in India. You have a lot of these apps. You can sign up on these apps and have a doctor's consultation, maybe 200-300 rupees, just like you would pay at a local clinic. And you can spend half an hour doing a video call with that doctor who tries to understand, diagnose you. And you take your own temperature check, share that with the doctor, and the doctor provides consulting. And then if needed, he then recommends you to a local clinic or a hospital. So that's one level. The other one that has really taken off, that's booming, is, say, online basic blood health, blood checkups, right? Say if you need a blood check, you don't need to drive down to a local clinic. If a doctor has recommended to you, you just sign up online on, say, 1mg or Practo or one of these apps, and that clinician will come home, take a blood test, and the report is going to be ready online within, say, 3 to 6 hours or within the day. Likewise, say, access to online medicine. You upload a prescription on one of these apps like 1mg or Pharmacy or even Amazon Pharmacy, and upload it, and within within half a day or a day, your drugs are ready and delivered to you at home from the convenience of your laptop or desktop. You just order these. So these kind of things are really taken off, especially in large cities in urban India. If you need to commute, you need to commute for more specialized things. Otherwise, the treatment comes home. Of course, you need to budget for it. It is affordable. The topic that I did not talk about is health insurance. There is health insurance available for Indians, but many NRIs, non-resident Indians, unless you're working for a multinational, you may not be eligible for the basic care of insurance, right? So you need to budget for it based on your